Extra.
I'm Natalie Baumke.
And I'm Melissa Wilson. One of our topics this morning is menopause. Yes, men going through menopause. That in just a moment. But first, a weather warning. Pretty mess sounds pretty nice right now, Mike. Some people jokingly call it menopause, a guy's version of menopause. Some doctors call it andropause because of the decline in androgen or testosterone. Others may claim it's just a midlife crisis. However you describe it, there is medical help for men that can make a big difference. 49-year-old Patrick Stoley says there's nothing embarrassing about it. He's man enough to admit guys should get help for typical signs of a declining testosterone level. What about the term menopause? Does that bother you? Menopause versus menopause?
No, it really doesn't. That type of thing doesn't bother me. If that's what they want to call it, that's fine. I think men do go through obviously some sort of thing as well. We lose our hormone levels as well, so they start to drop off. I think if you can get on something that will bring your levels back up, that's fantastic.
The Mayo Clinic says testosterone levels vary greatly among men, though in general, older men usually have lower testosterone levels than younger men. Doctors say males lose about 1% a year after the age of 30. So by 70 years old, they could have lost 50% of their testosterone. The symptoms?
Poor stamina, poor exercise tolerance, poor sleep pattern, poor response to exercise, loss of loss of muscle mass, increased body fat, things like that.
Dr. Richard LeConey offers a simple blood test at his Institute of Anti-Aging Medicine to check testosterone levels.
Statistically, you could say that testosterone declines somewhere in the late 50s to 60s. Some men, however, still have a very excellent testosterone level even well into their 70s.
Patrick got his levels checked when he was only about 40 to make sure he was staying as youthful as possible. He began taking HCG injections to prompt a boost in his testosterone.
The first thing that I noticed is probably I was able to sleep better and also feel more rested in the mornings. I think I had more energy as well during the day. And, I think long term, probably a little bit, I play sports and I had a little bit more stamina, a little bit more strength.
He also noticed that his skin appeared more youthful. Other patients at the Institute of Anti-Aging, like Mike Hoyden, use a topical testosterone cream every day.
All you can tell is if you don't do it, you start feeling tired and lethargic. If you do it, you got all your energy.
Just a little over a year ago, Mike came to a crossroads in life.
I felt like a slug. I weighed 360 pounds, couldn't lose weight, couldn't get up off the floor when I knelt down, couldn't work on my farm. Had to do something.
Mike discovered 3 things to get him back on track.
You have to have your testosterone's working, because when you're my age, your testosterone's kind of shot, your metabolic system's kind of gone. And you have to do the right kind of exercise, because if you do the wrong kind of exercise at my age, you can hurt yourself and then you can't do nothing. And then you have to eat the right kind of food and take in the right type of nutrition.
Once Mike figured that out, he lost more than 100 pounds with the help of healthy snacks, testosterone cream, and his trainer.
Health-wise, he was in pretty rough shape, as you could imagine, being 360 pounds. And just regular daily living was difficult.
But Dr. Sakula got Mike moving again, slowly but surely.
Well, when you get everything balanced, it's 180 degrees in the opposite direction. I mean, your health is almost perfect.
After changing his lifestyle and losing 100 pounds, Mike says he feels like he's suddenly 20 years younger.
Put it bluntly, my personal life with my wife is phenomenally enhanced. I can do things, I can go places, I can take care of my farm.
He says he got back his life. Patrick hopes others will learn they can benefit from a simple treatment as well.
I think it's a great thing. If you can extend your youth a little bit more, or feel better, sleep better, have more energy, for me, it's why not?
Yeah, why not? Doctors say it's important to make sure there's not an illness that could be prompting a low testosterone, like sleep apnea or complications from being overweight. So it's important to talk to your doctor if you suffer any of the symptoms we just mentioned, and not just attribute them to normal aging. Testosterone cream is regulated by the FDA and available only by prescription. Psychotherapist Mary Jo Rapini